My name is Elvio Gramignano. I'm the Global Marketing Director at Corin, and today I will be your host for this webinar. 5 years ago, we started a digital transformation journey designed to evolve Corin from a classical implant device to a smart orthopedic company. A few years later, that vision was communicated for the first time, and it is here in the slide now. So our objective was to revolutionize orthopedics by gaining, understanding, and sharing insights at every stage of the arthroplasty experience. And again, combining these insights with our clinically proven implants, we're planning to deliver superior healthcare value. That vision was summarized in 3 words that became our tagline. If you want our just do it. And it's connected orthopedic insights. With the launch of Corin Connect, our digital ecosystem, now the vision is starting to become a reality. And the webinar today has the objective to picture our vision discussing or starting to discuss with you where this journey is going to take us. So this is the agenda. We will have 2 presentations. The first one is a lecture that describing some real example will introduce us to the digital transformation in healthcare. So it will tell us how the digital transformation is changing already healthcare. The second one will introduce Corin Connect and Corin Registry. The presentations will be followed by a Q&A session with a panel of distinguished speakers. So you can start to write your questions in the chat box, and we will read them and pass them to our panel. Without any further ado, let me introduce you the first speaker. That is Dr. Nick van der Eyden. He is a graduate of the Royal Free Hospital School of Medicine in the University of London, that after several years of medical practice in London and Australia, decided to change his life and start to become the Chief Medical Officer for Dell. After several years, he's now based in the US, and he became an independent expert and leader in digital healthcare and sustainable innovation. I would say enjoying himself as a writer, as a radio speaker, and lecturer on futuristic trends in healthcare. Hospitals, physicians, and other healthcare professionals are still seeking his advice and counsel to integrate the use of technology to make healthcare system work from the perspective of quality and financial success. He's also the founder of the Incremental Healthcare, where he seeks out how small changes can be applied quickly and effectively to improve quality, reduce cost, and increase access to healthcare. So I would say Nick is absolutely the best person to introduce us to the digital transformation. Please, Dr. Nick.
Thank you, Alvio, and hello, everybody. Welcome to the presentation. I'm excited to be here and thank everybody for joining me to explore a little bit of the digital transformation that I see happening in healthcare. And what I'd like to do is to set off as part of the initial discussion is really to set the tone for this. I want to explore for you the disruption that I think is taking place in many industries and show you the adjacent possible and how that can be applied to healthcare. We know that disruption essentially creates an overturning of the traditional business methods and business practices. And as part of this, one of the things that we've seen and I thought would be helpful for this audience was to focus on golf. Why golf, you ask? Well, as it relates to healthcare, and in fact, in part to orthopedics, you can imagine that we have essentially standardized equipment. In fact, that standardized equipment goes back to 1764 when it was originally founded. And there have been some changes. The golf balls used to be made of wood, for those of you that didn't know. But we have variable terrain. There are limits to some of the access points that we have on a golf course. And sometimes we can move obstructions, other times we can't. But essentially, we come with a standard set of equipment. So what's happening to golf? Golf, it turns out, is starting to enter the data age. And here at Top Golf, you can see the combination of a number of things that are coming together that essentially bring data in the golf ball. So there's a sensor in the golf ball that tracks the flight over sensors on the driving range. It tracks the individual player and does so automatically. And what's important about this is we are now monitoring the golf club. We're monitoring the flight, the swing. We're including in this comparisons to other people. And from a competitive standpoint, this allows an individual to be taking golf shots in a driving range and comparing themselves not only to the people that are part of their group, but people that are part of groups elsewhere. And for those of you that play golf, one of the important facts to remember is that 80% of golfers never get below an 18 par or an 18 par shot. And if you hold that thought, I have some thoughts around how you might be able to change that I'll introduce at the end. But how does this relate to healthcare and medicine? Well, Lord Kelvin said back in the 1800s, if you cannot measure it, you cannot improve it. And for an extraordinarily long time in healthcare, we've struggled with the capacity to be able to track and monitor all of the data associated with healthcare and the healthcare parameters that we start to record. Now, to give you a sense of what's happened over the course of the last 10 to 15 years, we have what I term extreme tracking, and I want to use this example of Chris Dancy. He's a data-assisted living individual. He's highly monitored, and Chris wears multiple devices. He probably has of the order of 13 devices on him, and he has multiple that are installed in his home, in his car. And you look at this and say, well, this is at the end of the extreme capabilities. To give you a sense of what that looks like, those of you that have a Gmail account and a Google Calendar will recognize this is the Google Calendar. And this is his data. Each of those appointments is, in fact, a data point that's being pulled in from different sources that he's tying together. And you might look at that and say, there's not a lot that's relevant to me, but I would suggest there's at least one insight that somebody on this call might develop or use, and that's his experience with binge watching of TV. And what he noticed was when he watched 2 episodes of a single TV series in sequence, his behavior descended into poor behavior. So he'd go to the fridge, pull out the chips, dips, and so forth. And just changing his behavior and moving to different seasons. So he'd still watch the same amount of TV, but different episodes. That didn't happen. He lost 40 pounds in weight. Now, I don't think it was entirely attributable to that, but in terms of a data insight, that was extraordinarily important. And from a healthcare standpoint, we are not going to be offline. In fact, we may not be offline. I don't think we go online. We live online for the most part. That's almost even more true today with the COVID-19 pandemic and the isolation that's occurred and the fortune of having digital connectivity. Now, from a healthcare and in particular orthopedic standpoint, the key asset that's being expanded upon is really not so much the technology, the smartphone and the tablets, but it's the Internet of Things, or importantly, as I call it, the Internet of Medical Things. We are starting to add incredible numbers of medical devices that are tracking enormous numbers of data points in individuals. What does that mean, and how can you see that as an example? Well, many ubiquitous and low cost, always on, so they're always capturing data in a very frictionless environment. Activity, mood. You notice the individual in the car. One of my favorite monitoring devices is the weighing scales that sits in the seat of your car. No better place, although people aren't driving today as much as they were, but when we were driving a lot, great place to track weight. We're tracking sleep, mood, and we're moving into more detailed tracking, including glucose and DNA, and we might see more in the way of continuous tracking of that. What does that look like? Well, you can see in the video behind me that we have individuals tracking details that are available in a template that allows them to study here, looking at different locations where that data occurred, looking at sleep, looking at our mind and mind healthiness, looking at those details correlated together. And what that means is we can start to find those associations. What caused that poor night's sleep? So data is ultimately disrupting healthcare. It's creating an opportunity for prediction. And if those of you that don't see into this, you certainly are experiencing it on a regular basis from a weather prediction standpoint. I think we've come to rely on it, albeit in a relatively short-term fashion. But we've seen it in Moneyball and the stock market, with baseball. And from a healthcare standpoint, I think we're going to start to see this predictive modeling that will provide more insights. And the video in the corner there is an example of what this might look like for an asthmatic, where the air quality is deteriorating that we sense. They're woken up, they have a consultation with their physician. I know there are probably some physicians on here going, gosh, I don't want to be woken up. The good news in the digital world is you might not have to be. With the follow the sun routine, it could be a physician anywhere in the world doing that as coverage, and then providing better support and a better outcome for that individual. These are exciting times. And if you look at the potential of this, just one study, so many of you will know the Framingham Heart Study, developed back in the 1940s and took about 15,000 people and sampled them on an ongoing basis, but really intermittently, sometimes every 2 years, sometimes every year. They were brought in, they were assessed. And we developed some of the most important health insights from a cardiovascular standpoint for blood pressure, lipids, smoking, obesity, all came from that incredible study, and it's still producing today. Now we're adding to this with the biggest heart health study. You can see the link in the bottom there, and that takes data from all of these watches. It's additional contribution of everybody, so it's consented, and everybody starts to contribute. We've now got, I believe it's now over 1 million people are contributing to this data set. We're going to have extraordinary insights over a very short period of time. Very exciting from a healthcare insight and new capabilities. From a healthcare standpoint, that represents a big challenge. And we know that in medicine, complexity has been exploding. Just based on the number of registered studies, you can see there's an explosion. And from a knowledge processing capacity, I can tell you when I graduated from medical school, we had exceeded my capacity to process that information. So I think it's essential that part of this brings in the data element. We cannot be individuals in this whole process. We need the support to bring the latest insights to our patients as an augmentation of our clinical practice. And one of the really exciting areas is finding the unknown risk. And I know that sounds a little bit strange, but we know the patients that are having problems from an orthopedic standpoint of infection risk, potentially family history, certainly comorbid conditions, socioeconomic. But what are the unknown patients, the ones that go off or don't have the great result that everybody is striving for, and we're struggling to understand why? And we would have wanted to know that before the event so that we could have either done something differently or maybe an alternative procedure or maybe not that procedure at all. Data is going to provide the key for that. We've seen it with the application of machine learning, and this is really the key asset that takes all of this data, automates the process. We've seen it clearly in radiology where we start to analyze pictures with no oversight. It's essentially an automated learning tool that can identify problems in those images. We've seen it even with family pictures. Skin cancer, another classic. You can see voice analysis. And from an orthopedic standpoint, there are a number of papers that show we can detect mechanical loosening of implants. We can identify patients at risk of not achieving gains, but perhaps we can pre-identify them. And for those of you that deal with payments and treatments, one of the things that we know from a challenge standpoint is the hard patients, the ones that we know are difficult, typically get lumped together in a group payment plan, and we get paid the same, even though we know that case is going to be harder because of comorbid conditions and so forth. Well, with artificial intelligence and data, we can now demonstrate that that patient is going to be harder and more challenging for the individual to get a successful outcome. And this gives us an opportunity to get fairly compensated. And for the patients, importantly, they will now be attractive patients because people want to help them. They potentially might derive the maximum benefit from this total hip arthroplasty, which has been called the operation of the century, quite rightly so. So exciting times from a data acquisition and use. So as I close out, I wanted to share with you some thoughts around innovation and the challenges that you'll face as you look at this. We have to make choices that other people don't and do so quickly. And what that tends to do is to create an unfinished product. And the challenge for physicians and the healthcare world is we tend to like this perfect examples. We like to have proof, and we're struggling with that in this innovation world. But we move forward and accept that we are not perfect, and even if we can design a perfect product, things will change, as we've seen with the latest crisis. So focusing on a design and a process that gathers and uses and constantly moves as a result of this so that it adjusts and adapts quickly is essential. So back to my point about that 18 handicap that I mentioned at the beginning. So some of you maybe play golf and are struggling with that. Here's something that might help you. And again, one of the thoughts around this is an automated club. You can see that he's able to dial up both the club face and also the distance. That's an extraordinary development. And, you know, I don't want to get into whether this is cheating or not, but really focus on the incredible innovation that this provides and how much went into this. This is a speeded up video so that you could see some of the concepts. Importantly, with a regular club, he shot a 94, and with this club, he shot an 85. So he's not broken any major records. And as he said, one of the things that this does that I think is important for orthopedic surgeons is that he felt much better playing his round, and that no doubt influenced all of his behavior and included his shots. But that's not a terrible thing. So imagine if you go into the operating room feeling far more confident about this case because you've got all of the data. You have a really good sense of what the potential outcomes are, the potential difficulties, and have mitigated as much of that as possible. This is an extraordinarily exciting time. And, you know, golf is just one good example of it. And maybe some of you might go out and look for this, and I'd be happy to share the details of this. It's not mine, to be clear. This is some engineer that I have to be super impressed with. So let me close. The digital generation that we all are now doesn't wait for anything. We have to do things that others aren't willing to do. And importantly, I think people fear this in some respects, it's a replacement. This is not replacement of skills. This is augmentation of capabilities. And some of these things have yet to be imagined. One of the struggles I have constantly is thinking through what the opportunity is. And I think we see constant innovation with some of these insights and the data. And importantly, you have to make your own history. We can all look back and say it was predictable, but that's only in hindsight. And technology is, if it's going to do anything, it's going to accelerate at a blinding pace. And I think it's our responsibility to keep up or head to the tar pits. Thank you very much.
Thank you, Dr. Nick. This is really very, very inspiring, and gave us a little bit the appetite of what innovation can give us. So now it's the perfect time for Jim to let us know what is happening, what Corin is providing. Let me briefly introduce Jim Pierpont. Jim Pierpont is the Corin's Chief Innovation Officer. He holds significant experience in orthopedic industry, having enjoyed sales, marketing, and R&D roles in several of the major companies. I have to say, all with success, all the roles with success. He has undergraduate and master degrees in biomedical engineering and holds a PhD in personalized hip replacement. Jim is also well published in the field of spinopelvic mobility and led the development of Corin Optimized Positioning System, the OPS, as we call it. More recently, he has led the development and the deployment of Corin Connect. Please join me in welcoming Jim Pierpont in his presentation.
Well, thank you, Elvio, and thank you all for joining us today. As Elvio said, I'm Jim Pierpont. Probably many of you know me. I'm the Chief Innovation Officer at Corin. And for the next 15 minutes, I'm going to introduce Corin's vision and how our digital ecosystem, Corin Connect, will be the platform to take us into what we're seeing as a real new era of joint arthroplasty. So I'll begin by showing this simple but important equation from Michael Porter. Fundamentally, if we want to improve healthcare value, we must improve quality or decrease the cost. And this is the driver for everything we're doing at Corin. Historically, this improved value has come from implant innovation. The example on the right-hand side here shows the significant reduction in revision rates in total hip replacement with the introduction of highly cross-linked polyethylene. But today, most of the implants, both on the hip and the knee side, have justifiably become commoditized. Most companies have very similar implants, and that's because those particular designs do very well. So at Corin, we believe the future value is going to come more from digital technology as opposed to further implant and material improvements. However, to fully realize the value of these technologies, they must be connected. So what does connected mean? What is a smart device? Well, it's a device or a product that's connected to the internet so that it can share information and can communicate with other devices and systems. From home speakers to phones, TVs, cars, bikes, doorbells, we are seeing these smart devices everywhere across all aspects of our life. And at Corin, we recognized this evolving digital transformation that was occurring in orthopedics and the role that this connected or smart technology was going to play. So in 2016, as Elvio said, we redirected our focus towards connected orthopedic insight. And our vision is to revolutionize orthopedics by gaining, understanding, and sharing insights at every stage of the arthroplasty experience. And together with our clinically proven implants, we will deliver superior healthcare value. And so this is a representation of our ongoing digital transformation from a purely implant company to a technology company that sells implants. In the bottom left-hand side, you can see the foundation of this journey is our clinically proven implants. And we'll continue to innovate and enhance our implant portfolio through the coming years. Over the past 5 years, we've developed multiple personalized technologies such as OPS, Omnibotics, RPM, which by themselves complement our implants and add significant value to the joint replacement procedure. However, to get more value out of these technologies, we recognize the need to digitally connect them to enable the valuable insights each is generating to be shared across the different platforms. And this connected digital ecosystem is Corin Connect, deployed in 2019. And by the end of the year, it will be the single access point for all of Corin's digital technologies. By connecting all of these technologies pre, intra, and post-operatively, we'll be quantifying every stage of the arthroplasty experience and pushing that information into the Corin registry. And the Corin registry will then collate and analyze this unstructured data into key actionable insights presented through a personalized dashboard back to our customers. And we believe these insights will augment clinical decision-making and ultimately lead to improved outcomes. And in the near future, the insights in the Corin registry can be used to develop a suite of predictive algorithms which will be used to further enhance our implants and personalized technologies. So I'm going to walk through each of these stages of our digital transformation, starting with a brief overview of our personalized technologies, many of which I hope you're already familiar. I'd like to do this in the context of the patient journey from left to right. Our personalized technologies can be deployed in any one of these 5 areas, and they are patient profiling, functional and dynamic preoperative planning, intraoperative surgical execution, post-operative radiographic analysis, and finally measurements of the patient outcomes. And as I move through each of these, I'll introduce products that are in market right now. They are already launched. But of course, we're going to continue to innovate and expand our offerings in each of these areas. So firstly, patient profiling. So Corin RPM is our remote patient management platform. It's designed to improve patient engagement and outcomes and create efficiencies in the clinical practice. All of this whilst providing meaningful data which will be accessible to the surgeon via the Corin registry. Secondly is our functional and dynamic preoperative planning. An OPS Insight is the first of these planning solutions. It's a real-time, interactive, cloud-based preoperative planning solution for total hips. Utilizing our proprietary OPS Dynamic Intelligence, OPS Insight provides a dynamic assessment of daily activities, incorporating a patient's unique spinopelvic mobility to optimize component alignment. Next is our intraoperative surgical execution tools. So our Omnibotic technologies provide predictive soft tissue balancing to optimize total knee replacement positioning. The Balance Bot is the only device on the market that enables a surgeon to predictively balance the knee using real-time dynamic intelligence throughout the entire range of motion. For total hips, OmniVision is a first-to-market augmented reality navigation system, and it allows the surgeon to precisely execute the OPS plan utilizing augmented and mixed reality technology. The fourth area in which we're deploying technology is to measure the component position from post-op radiographic images. OPS Review is the first of these technologies. It enables a dynamic analysis of the radiographic outcomes of hip replacement surgery. In the future, post-op component alignment for both hip and knee will be determined from routine post-op x-rays using artificial intelligence. And finally, we're deploying technologies to help quantify patient outcomes. And primarily, we will do this with our Corin RPM app. However, we're also utilizing our own post-market surveillance data and are working actively to integrate the Corin registry with other national joint replacement registries across the globe. So hopefully that gives you a brief understanding of the different technologies we've already deployed across the patient journey. And I now want to focus on the next stage of the digital transformation, which is the connection of these personalized technologies into Corin Connect. So if we refer back to the patient journey and the different technologies being deployed, clearly we can't have multiple access points for all of these different technologies. The customer experience has to be designed to be simple and clean with a single sign-on to access all of these different technologies. And that single access point is Corin Connect. So it's the external face of our digital ecosystem. It's how our customers will access and interact with all of our digital technologies. And of course, it's available on a PC, a phone, and a tablet. But what's the value of this connectivity? All of our smart products, whether OPS, Omnibotics, RPM, they all bring value by themselves. So what's the added benefit of connecting them? And we really see it as twofold. So firstly, it's a seamless customer experience. It's clear in the coming years that technology adoption will vastly increase, and we can't expect our customers to be logging on to multiple different platforms to access these technologies. And Corin Connect is a one-stop shop for all the surgeon's arthroplasty needs. And that might mean connecting our ecosystem with other digital ecosystems in the surgeon's practice or the hospital, and this is something we're actively investigating. Secondly, it's the actionable insights generated from the Corin registry. For the first time, our surgeons will be able to quantify how decisions made pre or intraoperatively affect their outcomes. And with these actionable insights, they can modify aspects of the patient care to improve future patient outcomes. And we feel we have three key advantages as we transform into this new era of arthroplasty. Firstly, it's our focus. Connected Orthopaedic Insight it's not a sub-brand or a portfolio offering within Corin. It's our vision. It's everything we're working towards as an organization. Secondly, it's our agility. As a medium-sized company, we have the ability to adapt and respond quickly to the rapidly changing orthopedic landscape to meet our customers' needs. And as we progress further into the digital world, I think this agility is going to be more critical than ever. And finally, and perhaps most importantly, it's our dynamic intelligence. It's the insights generated by our differentiated dynamic positioning tools, OPS and Balance Spot. No other devices on the market are providing such a comprehensive understanding of the predicted outcome of a joint replacement based on dynamic information. So we really feel these areas give us a fantastic foundation to execute on our ambitious vision. So the fourth stage of the digital transformation is the Corin registry. And as shown previously, Corin Connect is a single access point to all the different technologies. And all of the unstructured data generated by these technologies are going to flow into our clinical cloud, which is the Corin registry. And here we can combine and analyze the unstructured data and turn it into actionable insights for our customers. So the Corin registry is an IRB-approved clinical data warehouse containing all the data generated from our personalized technologies. The clinical data is analyzed and the actionable insights are presented back to our customers to enable objective assessments of the consequences of planning and surgical execution on outcomes. And our customers are already utilizing the Corin registry for peer-reviewed publications, and we've already started to develop predictive analytics and Corin AI. And so here are just a few examples of the insights that are available in the Corin registry. So on the hip side, we can start to quantify sizing accuracy from what was planned to what was achieved, and we can quantify achieved component positions and compare those back to what was planned. We can display population distributions to help our customers identify outliers and adjust their treatment accordingly. On the knee, we can show population distributions as well. We can quantify the effect of preoperative deformity on intraoperative decision making. And ultimately, we can quantify how decisions around component alignment are going to affect patient satisfaction and clinical outcomes. So finally, our artificial intelligence ambitions. So we already have many AI algorithms running in the background to optimize our image processing, and they're on the left-hand side. However, the holy grail is to develop clinical AI algorithms, and these might include optimizing stem selection to reduce fracture and loosening, or defining optimal patient-specific soft tissue profiles given certain patient demographics and morphologies. The possibilities on the clinical AI side are immense, and we need to ensure the right clinical questions are being asked and that the AI learns from the appropriate and, most importantly, unbiased data sets. So in summary, our vision is to revolutionize orthopaedics by gaining, understanding, and sharing insights at every stage of the arthroplasty experience. And our digital platform that realizes this vision is Corin Connect, and it's available now. And the actionable insights generated by the Corin registry will augment clinical decision-making and ultimately lead to improved outcomes and improved healthcare value. Thank you for your time.
Thank you, Jim. I'm clearly biased, but this sounds incredibly interesting and promising. Okay, we have 20 minutes for our panel Q&A. I can see already some questions that are coming through. So first, please let me introduce the panelists. The first one is Andrew Shimin. Professor Andrew Shimin is a graduate of the Australian Orthopaedic Association training program, and he continued his education in the United States, United Kingdom, and Europe. In 1997, he became a member of the Melbourne Orthopaedic Group as a specialist hip and knee, and is currently director of their research foundation. Professor Shimin has performed over 10,000 surgical procedures and has over 100 publications in major orthopedic journals and book chapters. During his career, he's been president of the Australian Orthoplasty Society, member of the International Hip Society, AAOS, ACAS, advisor to the Australian government, and in the safety and efficacy of the medical device. He is the father of one of the fathers of the OPS, and he has contributed to the improvement and the clinical investigation of it. And as a person, he is, as he says, a golf tragic. So I hope he has appreciated the analogies of that Dr. Nick made on his presentation. Dr. Kreutzer is a native of Switzerland, and he graduated from medical school at the University of Texas in San Antonio in 1995, and then completed his orthopedic surgery residency in the medical branch of the same university. Dr. Kreutzer has performed over 5,000 anterior hip replacements and has pioneered the development in minimal invasive and computer-assisted hip and knee replacement surgery. He's also a world expert on robotic joint replacement surgery, having been involved in the development of Mako and Think surgical robots. He serves on medical advisory boards, in several medical advisory boards, and is the board member of ISTA and the chairman of the master course on anterior hip replacement surgery with the ICJR in Houston. Among the different things that Dr. Kreutzer is doing is also revolutionizing the field of the outpatient total joint surgery by working to develop clinical pathway and protocols to allow minimal invasive surgery being performed in the outpatient setting. He's also the founder of a company called Innovate that is bringing innovation in the healthcare industry. Rumor says he has found the secret to stretch the day to 36 hours. And this is how he can do all these type of things. And this should probably be the first question that we want to ask him. The second panelist is Stefano Alfonsi. Stefano Alfonsi is the Chief Executive Officer at Corin. He has a doctorate degree in medical engineering and an MBA, and also an extensive experience in orthopedic, having spent most of his career in this field. He is recognized for his ability to combine futuristic vision with the daily execution, because in the last 12 years, he's been able to deliver constant double-digit growth to all companies he's managed. He is the mind and the arm behind Corin digital transformation, having contributed to its design 5 years ago and driving it every day through a never-ending journey. So, great panel for the discussion. I can see already a few questions coming through, and the first question is for Andrew, and is the core of all these story. Jim alluded to some of the benefits, but again, the key question that I can see here is, what is the real benefit from the surgeon? What is your perspective as a surgeon on the key benefits of this connectivity?
Thanks, Alvio. Look, I think there'll be a lot of repetition that goes on. All these words I'm about to use, you've heard before in these two really great presentations. But I'm going to start by saying something black and white and a bit confronting to orthopaedic surgeons who might be listening. That in my view, implants that we use in hip and knee replacements will not get any better. We can talk about for hours as to why that might be an opinion. But the key to us making these fabulous operations that we're so lucky to do, the key to making them better is to plan them better. It's not just you kind of turn up and do an operation and think, yeah, well, 90 to 95% of people are happy. So we have to plan more. And then once we have a plan, then we've got to achieve that plan. So implants aren't going to get any better, and planning is the key. And then we've got to implement that plan. So to me, if you ask me the tangible benefits of Corin Connect, that will summarize it. So in a way, we can optimize, personalize an individual operation based on a whole bunch of data that Jim has told us that can be collected. So we get the data, we can implement that data with the robotics, augmented reality, and we can follow how the patient goes, with the remote patient management. So I think we can put this in a surgeon vocabulary that every aspect of what we do can be made better with some, if not all, of what Corin Connect can offer. And just a couple of things in addition, in answer to that question. I found the patients find it incredibly interesting, in particular with the OPS Insight, the planning, and they also find the registry data where they fit in the rest of the population. So the preoperative data that we collect, we can then show them, and they can see where they sit in the whole community, and they really like seeing the effort that's gone to in the planning, and there's a great deal of comfort they get from it. Last thing I'd just like to say, Jim mentioned about the single sign-on. Now, I'm not sure who's listening, what country you're in, but I think Australian surgeons will understand. Just really, think of the radiology, the current the viewing of imaging at the moment. I'm sure it's the same all over the world. You've got to log in to a different radiology practice or service, and in one consulting session, you might log into 6 different platforms to see some radiology. And this single sign-on, I love Jim's word, that single sign-on where everything you want there, the radiology, the patient-reported outcomes, pre-op, post-op, the plan, it's all there. So, that's as I see it, as the tangible benefits to every part of the way we practice arthroplasty surgery.
Stefan, do you want to answer on this question?
Yeah, no, I one of my favorite quotes is, what can be measured can be managed. And I think we all have to improve. Even though I do a lot of surgeries, I'm a much better surgeon today than I was when I started, because I always try to learn from the last case. The way we have been doing it is not very sophisticated, because you sort of remember what you did and you try to do better because the patient did well. So Corin Connect of really, feeding information into the daily workflow for us as a surgeon to do better for our patients is where it needs to be. And I commend you on taking this journey. It's not an easy journey. There's a lot of platforms. Most people don't know what an API is, but you have to integrate all these platforms in order to do this. But I strongly encourage you to continue pushing very hard to make us better surgeons for our patients.
Thank you, Stefan. There is another question for you here, and is asking, how do you think this technology will evolve the ambulatory surgery center in the US mainly?
Yeah, I think especially in the ambulatory surgery center, this type of technology is extremely important because we have to get the patient operated on and out of the building within 23 hours and 59 minutes. We just completed our first year in the surgery center. We had our anniversary 3 days ago. We've done 300 total joints. Our average length of stay is 6 hours, and we've had only 10 patients that had to spend the night. But we continuously try to improve on efficiency, and really you can't take 3 hours to do a total joint in the surgery center because you weren't prepared and hope that they will go home the same day. So especially in that setting, it's going to be much more important to have this data. Also, it's easier to incorporate it into your workflow because you control the facility, you control anesthesia, you control your staff. When you're dealing with a hospital system, it's much more difficult. So I think the implementation will be much easier in a setting that we have at Innovate, and hopefully other centers that will do the same.
I have a question that is coming from a surgeon that woke up very early this morning to attend this webinar because he's based in the US. So I would like to ask Jim for this question. And the question is, will the Corin ecosystem include also patient education?
Absolutely. We already have patient-facing material through the Corin RPM app, which guides the patient through their journey. But if we need to start to show some of this information, the right information with consultation with our surgeons to patients, and that's absolutely possible. I think by having all of this information in the cloud, anything I suppose is possible in terms of who we present that to. I think Nick alluded to this, Andrew's just alluded to it. The opportunities here are endless. So if we need, at the moment, very much Corin Connect, I suppose, is surgeon-facing, clinician-facing. It's easy to evolve that into a patient-facing platform as well.
Excellent, Jim. Thank you. There are several questions coming through on this second topic that I'm going to present to you today, and I would like to hear all the panelists on this topic, and it's the topic of data. So the question basically is there are a lot of concerns around data compliance first, but also the ethical use of data. So again, I would like to start probably from Jim and then going to Stefano to hear the company position, but then I would like also to hear what Professor Andrew Shimin thinks and Dr. Nick. So Jim, if you want to start.
Yeah, look, Matt, that's the number one question. I think it's a great question. I think I can say categorically, and Stefano will reiterate this, the only intention that Corin has for this data is to improve patient outcomes. We have no other intention to do anything beyond that. We are GDPR compliant, HIPAA compliant. We capture the data legally and ethically with patient consent where necessary. Again, we're presenting this information back to our surgeons, again, so that they can utilize that data to improve outcomes. There's no other intention. We are soon to be ISO 27001, which is a data compliance accreditation in terms of the top level of accreditation for managing that data. We have IRB submissions around the world in terms of the ethical support around the Corin registry. Again, I'm not we have a legal counsel working on this 24/7. We absolutely acknowledge the importance and the privacy and the anonymization and the compliance of the data, and we actively embrace those conversations with our surgeons, and I feel we're doing a very good job in terms of compliantly managing the data.
Thank you, Alvio. Gaining understanding and sharing insight means managing data. Obviously, data is a very hot topic. So we set our strategy towards two main guiding principles. One, we need to deal with data in an ethical way, and secondly, in a legal way. Obviously, the legality is different in different countries. And as you know, we're dealing with data across the globe, so we have to be legal across every country we operate in. Therefore, we need to be legal on the more strict legislation we're dealing with. The main principle is to deal with data in an ethical way. And the main guiding principle there is we're using data only to help the surgeons to improve outcome. Whatever we do will have as a result to improve outcome. We're using the data, we understand the data to improve outcome, to help our surgeon to improve outcome. So connected orthopedic insight need data, and the ethics on which we're using data has the only goal to improve patient outcome.
Okay, Stefano, thank you. Stefan, I don't know if you want to add the surgeon's perspective.
Yeah, I mean, it's a much discussed. You don't want to be Facebook, right, where Facebook steals your data and then they get in trouble for doing it. So it is a discussion that we've had on board meetings, and I commend you in your openness on these discussions, and I agree with Stefano. Lawyers are going to have to get involved, unfortunately, but that's just the business that we're in healthcare, and we have to be. And if your premise is to do good, to improve patient outcome, that's to be commended to as well, because ultimately that will help you as a company from a revenue standpoint as well. If your patients do better using your implants, then the word gets around. So you should never be, conscious capitalism always says, you should never be motivated by financial reward. You should be motivated by purpose. And if you are, the financial reward will come 3x. So I commend you in doing what you said, Stefano, and I'm excited.
Andrew, what is your position as a surgeon?
Yeah, look, it's a great question, Adam. And I've fortunately, most of my career lived through the evolution of something very, well, it's not simple, but a joint replacement registry. So my career started at about the time, just prior to the start of the Australian Joint Replacement Registry. And I can remember these conversations happening and surgeons being concerned about their data and patients' data being taken off-site and managed by someone else. And it was a really hot topic. And I think now, with the ways of de-identifying data, I think we've become confident that this is possible. That would be my view. I was one of the people who was really unsure about what would be done with all the patient data, but I'm totally comfortable now in that registry setting. I don't even think twice about it. And I think that's what we have to get used to here. If we want to do better operations, we need better data, and the only way you get that data is to help collect it. That's as simple as I see it, yeah.
Thank you, Andrew. Nick, what is your perspective? Again, you have probably a wider view. How do you see data being used in other healthcare sectors?
So I start from the premise and perspective that, trust is the most important issue for healthcare delivery, for clinicians, for companies in this space. So managing and preserving that trust is the sort of foundational principle. From a patient perspective, I think there's not a patient on this planet who says anything other than, I am happy to share my data as long as you don't use it against me. And I think the principle here is very clear. We can contribute as a group, but we need the aggregation of that information to be able to develop insights. As Andrew said, we've developed this and we have the technology to support it and protect people's privacy and to allow for it in a way that offers valuable insights, but it's not pejorative. So I think the opportunity, we're at this watershed moment to allow for this, but it's important not to break the trust. And I'm just delighted to hear that, directly from the company, from, the leadership that says, we want to improve things. I think that's important, and it's built into the culture, and I think people have to trust that. I know I do.
Now, I would like to ask first Andrew and then Stefano a question that is coming that I think is relevant, and is who should pay for this technology? Should be paid by the company, should be paid by the patient, should be paid by the hospital? Who should do that?
Yeah, nice one. Thank you, Alvio. Really nice one. Yeah. Look, my answer. Let me go back to Nick's analogy of that golfer with the club that could alter. I'm a keen golfer, as it was said. I really didn't like that analogy, Nick. We can talk about that later. But here's this guy who alters his club, and from one round to the next, with this alterable club, he goes from 95 to 84 or 94 to 85. Now, anyone who plays golf knows that even with a standard set of clubs, you can go out and shoot those two scores with the same set of clubs. But what I'm getting around to saying is, you mentioned at the end of that analogy that if nothing else, he felt better using that custom-made club. So that gets me a long way to answering this question. If you take away aspects of Corin Connect, in particular the bit that's most part of my practice at the moment, the insight, I feel less confident. And it's really become part of my practice. So therefore you'll say, well, am I prepared to pay for that? And the answer is no, I'm probably not prepared to pay for that. And I think, so how do we make this economically viable? Well, I think it's up to the industry to say, look, if planning can work out what implant a patient's going to need, and so therefore the full shelf of implants don't have to turn up to the hospital, then surely that must allow some cost benefits for the industry. And therefore, if you like, the technology would pay for itself. And I think the other, my rather probably polarising view here would be that the payers, the governments and the insurers, if with the use of this data in Corin Connect can be shown that better outcomes occur, then there's some value in that in terms of the patients are happier and there's less revisions. So, that's a very obvious surgeon answer. I'll say, you take it away from me, and I feel a little bit new, but I don't want to pay for it. And I accept that industry and payers can pay for it. So there you go.
Idea from my point of view, historically, the industry used to pay hardware, the implants, the knee replacement, the hip replacement. We now start to go into the area where we can sell on system or service like the robotic system, augmented reality, the OPS service. And that is a journey we are transforming now. The real end of the digital transformation from Corin will be when we can sell outcome. We're not ready yet. We don't even have the evidence to be able to do so. But the true transformation will occur when we can provide to hospitals, to surgeons, to insurance, to governments, guarantee of outcome. This is our product, the guarantee of outcome, based on the data, based on the artificial intelligence, based on the service that's to be provided to achieve the outcome. Then is when the business model will be completely transformed. We are not there, and we are in a journey, even on the commercial side. Yes, we are on a journey on the technical side, from implants to system and service, like the augmented reality, like the robotic system. The future is provide a service and sell outcome. And I'm sure when we'll be there, people will be very, very happy to pay for it.
ultimately, value follows through. And if you think about the value of the concept of this data is ultimately it flows through to the patient. So the patient, would pay for it. We have this, different system of payment. It's different in other countries. But if you think about the value proposition from an improvement in the overall outcome, so less replacements, shorter times in place, in hospitals, in the care, better outcomes that are, delivered for a longer period of time, that's value. So, along your principles, I would put it slightly differently and say it's a bit like the road system. People don't pay for the roads. They do in terms of taxes, but we all expect them to be there. They're there to sort of help guide us. And in my mind, this is a sort of a GPS. The GPS is there. It's being paid for. It contributes. And we all participate by paying our little contributions for the elements that we get, but appropriately not penalizing the physician who gets some value, but ultimately it's ending up for the patient. So I agree with you. I'm just sort of framing it slightly differently as a sort of a fundamental principle that sort of underpins everything that's being done by the orthopedic surgeon in the healthcare system.
As you can see, we're not hiding difficult questions here. There is a technical question that I would like to ask first to Jim and then to Stefano. The question is Corin Connect open or a closed platform? And if it's a closed platform, do you plan to open it in the future? So if, Jim, you can respond technically, maybe Stefano, then you want to answer from a strategic viewpoint.
I guess technically it can be open or closed. It's currently closed. That said, as I mentioned in my presentation, we are actively working with different providers to connect to different hospital systems and surgeons' rooms. It's a relatively simple thing to do technically if the infrastructure is there on both sides. So it's very much possible to do. We're actively looking at it. At the moment, it's a closed platform to Corin. I think my perspective here, and maybe Stefano disagrees, but my perspective here is if this is successful, I don't think you'll be able to stop it becoming an open platform. If people want to use this, they'll want to use it across the board, and we would potentially then have to make that decision to open it up. That's my perspective. So at the moment it's closed. It could be open in the future.
To be accurate, it's closed towards other implant providers. It's a closed system because the major source of revenue for the company, what pay for all of this, is the implants revenue. But it's already open towards other technology that feed into the ecosystem. The point that Jim is making is very relevant. If the Corin Connect will, in my opinion, become successful and will deliver the vision, we'll be forced to open. And is a break-even between gather more data, accelerate the digital transformation, accelerate the prediction of outcome, which come with more data, with the revenue that pay for the transformation. So it's a real balance. It's a very fine line that we are working and we are dealing with every year. If the success will be very fast and very good of this Corin Connect system, we will open sooner. And we already have some opportunity to open to non-competitors' products into the ecosystem. If the success will be slower, of course, it will take more time to transform from implants to digital data.
Nick, next question is for you, and it's specifically related to the device and trackers that you were mentioning in your presentation. Which tracker do you think will win? We can see many, but probably there will be one that will win over the competitors.
Well, that's a loaded question. I have to believe that the tracker that ultimately wins will be the one that has the minimum requirement or impact. And I wish I could turn my camera and point to the drawer that I have next to me that is full of all of the devices that I've essentially tried and used for a short period of time and then ultimately discarded. Anything that requires effort on the part of individuals, tends to struggle. So all the passive acquisition, and in that instance, I think where we just implant it or it's incorporated into general things. So if you think about wearables, I think they'll be built into clothing. The idea that your clothing will have it, your joints are going to have it. I'm certain of that at some point in the future. Our rooms will have it, and will understand more about us. They'll be able to survey, our movements and so forth. So I don't think it's so much about the individual device or the winning system, but importantly, and I think this is what Corin is directed towards, it's the integration of that brings value. So I want to have it, but I want the value proposition that allows me to make an improved decision as a surgeon, as a patient, as a payer even. So I think that will be the deciding factor, is where the value proposition comes.
Thank you, Dr. Nick. Is specifically to Corin Connect, and I would like to ask this question to Stefano. Will Corin Connect will always be a closed system, or are you planning to open it to other technology or other implant manufacturers?
This is a great question, Albion. First of all, I need to say that Corin Connect is close towards other device manufacturers, other hip and knees products. So for now, it is a closed system, although it's open to other technology that we integrate into Corin Connect. And as we discussed before, Corin Connect analyzes data before, during, and after surgery. So one of the challenges we have to present the value is actually to move away from the value of the device, the implants or the robotics, and be able to deliver the value that comes from the overall cost of the procedure, all the events from the beginning to the end. It's when we'll be able to monetize the value of our technology throughout all the experience, all the journey, is when the magic will occur. And to me, it's a race. It's a race between the data we're collecting and the data we try to learn from, and the revenue that we generated from our implants. The day where our system will take over in terms of revenue generation compared to the implant generation of revenue is the day we will make an open system. Will happen. If the system will be very successful, will happen sooner. If the system will struggle a little bit, it will happen later. We all hope that it will become an open system that will incorporate a mini-other device, and will be a standard for the industry. Obviously, that is the dream. And it's a journey, because we used to sell the implant, we used to sell the metal and plastic. Now we sell in service, we sell in the robotics, we will sell in the OPS. Tomorrow, we want to sell outcome at a constant cost, a cost that guarantee all the journey from the beginning to the end for the patients, at the level of outcome that we can guarantee.
Excellent.
Yeah, thank you, Stefano. There is a question that is specifically asked to Stefan, and but I don't know if you should be the person that answers to this question. The question is, do you think that this connectivity will ever be reimbursed?
To the surgeon?
In the healthcare system, yeah.
Data is very powerful, and I have a full-time computer programmer, and we're looking to develop a data warehouse, and we're doing it because we have so much data in our electronic medical record. We're now starting an electronic medical record in the surgery center. In fact, the electronic medical record gets hooked up to the anesthesia machine, where all the anesthesia data gets downloaded into the electronic medical record. So data is incredibly powerful. And I think eventually, I hope that we will get to a place where the insurance companies require you to collect data and reimburse you for it, because it will improve outcomes so much. So that's surely my long-term hope. I don't think it's an unreasonable hope, because again, we need to be data-driven. What can be measured can be managed. If you don't look, if you don't measure, how can you get better?
And if I may, I want to add something to that. I think absolutely, but importantly, not as a burden to the physician for collecting that data. The passive acquisition and incorporation is essential to that model so that they're not overburdened with the collection process.
Agreed, because we don't have enough hours in the day. You know, I get 36 hours, as you said, but most people only get 24.
And if I can ask, if I can add, Elvio, it's fascinating to me how innovations are occurring next to the OR. As you can hear, Stefan is collecting data next to the OR. The innovation is moving towards the user, and that is the macro trend across every industry. To me, to be honest, Stefan, I think the reimbursement will come when the outcome will be improved, when we'll be able to prove the enhancement we deliver to our outcome. Right. It's not anymore the day where the invention, the new toy, will be reimbursed. We have to really deliver the value, means improving outcome. It's fascinating that you're making an innovation next to the OR surgery.
And, you know, we have not historically done a good job of collecting data. We don't even have a joint registry in the US, which is really sad. You are not only putting a registry together, but you're doing way more than a registry. A registry is only what goes in and what comes out. You're really trying to correlate clinical data, pre and post, with intraoperative data to drive a surgical procedure. And that is the future, no doubt in my mind. We have to do this. It's embarrassing that we've not done it better. And if you really look at implants, and install, and you know, the install knee that we designed 35 years ago doesn't look a whole lot different than today, because we really didn't know how to improve them. I mean, they're better sizes, better curvatures, and so forth. But if we want to do better, we have to collect data. So again, can't congratulate you enough for taking that path and focusing on getting it in a very good clinical way to help us be better doctors.
Perfect. I think we are right on time, and really I would like to finish with these words of Steph. I would like to thank all of you for attending this webinar. Please follow us on LinkedIn or on our website, or just the easiest way is probably to talk to your Corin representative in your area and get all the information. But clearly, this is a very important element, is our vision, connect the orthopedic insights. We'll continue to communicate on this. Thank you, and have a great day.